When our son was diagnosed with stage 4 cancer, we wanted to know everything science and experience has proven effective. What we found was a lot more than we were shown at the hospital. With so many highly educated, seasoned professionals operating outside the bounds of conventional medicine, it just didn't make sense to limit ourselves when the stakes were that high. This approach paid off, and now we're bringing the information to you. Wisdom from the top integrative and holistic cancer doctors and healers around the world, all in one place. Because you deserve true answers to cancer. It's time for a revolution against one-size-fits-all medicine, a revolution that takes us back around to the old ways of healing and forward to the new. That revolution starts right here. When it comes to reversing or preventing cancer, this is where you come for the best of the best. I'm Ryan Sternagel of the Stern Method, and this is the Anti-Cancer Revolution. Hey there, it's Ryan, and this episode is from a deep dive webinar we did on one of our favorite healing products or services that my family feels has made a difference in our own healing journey. If it sounds like something useful to you, make sure to stick around to the end for info on how to get a deal on it and how to be on future webinars live and get a really special deal when they happen. But for now, enjoy the show.
But what's on your mind right now when it comes to cancer? Could be a new treatment, could be a new supplement, could be the different way to approach it, or something you thought about in the shower this morning or whatever. Spot question, Dr. Stone. I'll start with you.
Cool, definitely. I mean, for myself, it's cancer in general. This is something I've actually been working with through my clinical training quite a bit, and really just understanding how important the lifestyle factors behind cancer really truly are. I mean, when we look at the studies, 85% of cancer is actually lifestyle driven, not genetic. So we know that, and it's what we're really doing to our bodies. So I think it is just so important to always look what actually caused the cancer to begin with. Based on this information, we know lifestyle is such an important factor, and not only treating with the conventional treatments that are there today, which yes, can be successful, but also understanding why the body took on cancer to begin with and really approaching it that way. So for me, that's always one of the biggest aspects, is doing a very thorough history with the patient to understand everything that happened from day one up until this point, what could have led to why they're here. So
something caused it. Yeah. That's my big thing, is like, with cancer rates going up, the conventional, the conventional thing is, well, people are just living longer, and so of course, when they get older, they're going to have cancer. And when you pick that apart, it doesn't work. But when you look at childhood cancer, what we went through, it's like, 100 years ago, for all intents and purposes, childhood cancer didn't even really exist. I mean, my son would not have been born with cancer 100 years ago. Now there's entire city blocks filled with, dedicated to hospitals taking up those entire city blocks, just housing kids with cancer. So it's like, it's something is causing it. That's our main message. Jim, what about you?
Yeah, I know for me, being on the back end, of I'm sure we'll talk about it a little bit. I had colon cancer, and being on the recovered end of that, the things that I constantly go back to is those consistent daily habits, just like Dr. Stone said. It's that lifestyle. It wasn't enough just in that year where I was like hard going at it with all these, supplements and treatments and, whatever. That's fine. But then the subsequent years, it's that consistency and not falling back into old habits, and maintaining the good new habits. That's something I'm always trying to be very mindful of. And then instilling those habits it's interesting with kids, and I'm sure you know this, Ryan, too. It's, I was raised, my mom was very, clean eating. She's a fitness instructor. She owned yoga studios. I mean, she's just very much, clearly didn't wear off on my lifestyle choices when I got older. So for me, it's instilling those in my children in a meaningful way, where they really kind of understand the depth of why we do it. Because I guess when I was a kid, I just didn't really understand the why. I had a lot of good advice, but then when it came to the why, and in the long term, I'm always trying to find fun ways for my kids to understand why it's important to have those good daily habits. And and be consistent with them. So yeah, that's definitely something always on my mind.
Jim, I thought you just reversed your cancer with Haelan 951 alone, and you didn't change your lifestyle or anything like that.
Yeah, magic, right? No, not at all. Yeah, I would never tell anybody that. No, not for that, not at all. I think it's a great addition. We've talked about it before, but yeah, you gotta do a few other things.
I've talked about Haelan so much over the years that I don't even know where to start. But I mean, I think the best place to start is my personal experience with it was literally, my wife and I were living a, normal, whatever, first parent life for the first 11 months of my first son, Ryder's existence, his new life. And then he got diagnosed with stage 4 cancer. And I had seen my old high school friend, Jared Tedesco, posting, I didn't really pay too much attention to it at the time, but he was posting about some, some stuff that helped people with cancer that he was involved in or whatever. And that's about the extent of it that I really paid attention to. And then my son gets diagnosed with stage 4 cancer. And we were already far enough down our own starting to, try to get healthy route, I guess you could say. We were, watching all the documentaries and trying different diets and, removing chemicals and removing EMF and eating organic. And I mean, the impetus for that, ironically, was just even knowing that we were going to have a child. We started doing all that stuff, leading up to even conceiving. But yeah, so I mean, that was kind of, we were very open to different approaches and that sort of thing. And then we got that diagnosis. That's the first thing I thought is, okay, I'm kind of, I know I'm going to start digging into studies and that sort of thing. But I saw my friend Jared posting about some stuff that he helps people with, and so I reached out to him, and it turned out that this stuff was Haelan 951, and it's his family business, and his parents had been in it for years and years, and they had stumbled upon it by accident. You guys probably know the story better than I do, but yeah. And so he was kind of helping out with the business at the time, and we got a case of it. And so that was literally the first product we had our son on. But the reason that Haelan 951 continues to be one of our staples is it wasn't just some, Jared wasn't just, hucking some random supplement that he threw together that he could sell on Amazon or something. This was something that, that they took and did a whole ton of research on. And I mean, there's so, I don't want to give away the presentation, but there's just, an amazing amount of research. And, I started going to all these conferences and talking to all these naturopathic oncologists and functional medicine doctors and integrative MDs and all this stuff. And it's like, it was the one product that pretty much any doctor that I asked about it would be like, oh yeah, that's, that knew about it anyway. And I'm still surprised that it's not more just of a household name than it is with all the studies out there, but we're trying to change that today. But it's like, near unanimous consent. Everyone that knows about Haelan's like, oh yeah, that's amazing stuff. It's, it certainly doesn't hurt any, any cancer journey. And it's going to be like more than that, it's going to be a huge benefit to any cancer journey. That said, that was Ryan's rambling introduction, but Jim and Dr. Stone, you want to go down the line introducing yourselves?
Cool. Awesome. So yeah, I'm a naturopathic doctor here in San Diego. I work out of a clinic called Tulsi Wellness Center, just specializing in integrative medicine. So we see many different types of patients throughout our clinic, and really just trying to restore true wellness and balance, and doing what a doctor truly should be doing is being a teacher. That is the definition. So our goal is really just to help transcend some more information to people to understand their bodies, understand different ways that healing can happen. And that's kind of where I'm at right now, just really building my practice, trying to help as many people as possible. I had a whole career before going to medical school that I decided just to drop and leave because I didn't feel like I was fulfilling my purpose, what I could truly do by becoming a physician. So that's where I am now. And end of the day, my biggest goal is just to share this amazing side of medicine as well to people.
I say, Jim Ladwig, I'm over here at Haelan Products. I have a kind of a story in a vein similar to Ryan's. I actually knew a Tedesco family member and then was introduced to the product. It was one of the other brothers. So it was Jordan, Jared's younger brother, and I worked at a company together, and he introduced me to the Haelan 951 when I was diagnosed with colon cancer. And it was funny enough. I mean, we'll kind of get into this. The stuff, well, first, hands down warning to everybody: it doesn't taste great, and we always lead like
Come
that.
on.
And I know Ryan.
Yeah, that's what I said. Like, look, I was shoving it down my kid's throat, but ironically, like, he must have known that, you know, he must have had that, you know, baby intuition or whatever, and he actually took it quite well.
But I was impressed with some creative ways that you came up with, you know, mixing it in with different things. And, you know, I think that's so, you know, good. Cause, you know, one, you can kind of get other things, but, like you said, there's like this weird intuition when you start, taking Haelan 951, you get about a week in, your body just starts to crave it. It's weird. It doesn't taste great, but your body's like, yeah, this is doing good things. But anyway, so I when I was diagnosed, Jordan, Joe Tedesco's son, Joe's the founder, and Joe Tedesco's son got me on the product. It was one of the first real kind of you know, aggressive, holistic ways that I went about, you know, in my recovery. And then as I did that, you know, obviously bringing on, because it was pretty early on, from the time I was diagnosed to the time I talked to Jordan. And that honestly launched me down just a very awesome rabbit hole of, you know, eating organic and just really cleaning up my diet, my lifestyle, and some major stressors that I had was, you know, eliminating those. Cause it was the further I went down the food categories, it was like, oh, wow, this mental category is pretty tied in. This spiritual category is pretty tied in. So all those different things I had to, you know, work through. And I really give a lot of credit to, you know, Haelan kind of catalyzing me down that pathway. And so I got on it and I did the, you know, kind of initial protocol thing that we suggest in the situations, and saw such a good recovery. It was probably 2-3 years later when Jordan, who is now our new CEO, he called me up and said, hey, I need you on the team. I was hands down. I was, yeah, let's go. I mean, I have such a, you know, place for this product in my heart. You know, I was like, okay, yeah, I could really get on board with this. And it's definitely a passion of mine. So it's been really good. And I've been here a few years now. You know, the stories, the thing, like things Ryan has shared over the years, the other people, the feedback, it's incredible. And I really do love those kind of day-to-day calls with people as they're working through that journey and making those changes and seeing some pretty awesome things. When conventional medicine, you know, a lot of times has kind of failed them, they turn to stuff like Haelan or various other things. You know, obviously it's not the only thing out there. And you know, I love having those phone calls because it gives people, you know, kind of a second chance at it, and to kind of take it from a different angle or a different approach.
Yeah, and I mean that's one thing I love about the Haelan company as well, is it's not just, you know, it's not just trying to sell a product, but you guys actually want to talk to everyone that's using your product, and making sure they're using it the right way and getting the most out of it and all that stuff.
Awesome. Well, I think it'd be good for Dr. Stone just to kind of, you know, open us up with, you know, his understanding of the field. And then also because Haelan 951 is soy, it's a 100% soy-based product. There's a lot of maybe, you know, misunderstandings and there's a little bit of education component that when you're dealing with soy and the type of soy we use and the differences of conventional soy. So I think it'd be good for him maybe to speak to some of that stuff. So, you know, whatever you have to share, Devin, that'd be great.
Oh, for sure. Definitely. I mean, I think just starting with the product itself. So it is a fermented soy-based product where they really concentrate a large quantity of soybeans to be able to give you the nutrient load in a very small drink. With that said, I mean, just over the years, I think that's where there's been so much confusion, especially in the world where we have estrogen-driven cancers. Is soy good for you or soy bad for you? That's a standstill debate that goes back and forth all the time, but we really need to dive into the research and what's going out there. Anything that is in clinical practice, at least the way we're trained, we do what's called evidence-based medicine, and making sure if we are giving a therapeutic to someone, we know it works and it's not going to cause more harm to someone. So what that looks like is soy, we know, is very rich in what are called phytoestrogens. There are different isoflavones that are actually within the soybean itself that really kind of brought up this whole debate from the beginning, because some of the cancers within the body are estrogen driven. So the whole idea behind that, people were saying, is why would we give actually more estrogen to a person if they have a cancer that's driven by estrogen itself? So this is where a lot of the kind of early theory came about. But however, now today, we really know how these phytoestrogens are working in the body. We understand that they actually are docking or linking onto a different receptor of the estrogen receptor that actually becomes what's called an antagonist. So it actually shuts off that receptor. So all of these other estrogens that are in our body don't have the ability to signal that estrogen receptor and stimulate the cancer pathways that are happening afterwards. And as we know today, I mean, our world is filled with many xenoestrogens, meaning estrogens from outside sources that are coming in products we're putting on our bodies, foods that we're eating. I mean, the air we're breathing, they're just everywhere today. So, and one of the reasons I do think, I mean, cancers like breast cancers are going up so high are because of these. Now this is actually a mechanism that could help shut that off for these type of cancers. Not to mention all the different properties that this has as well, with major aspect being that it is a fermented based product. So you're getting a variety of many different probiotics, which this world as we know today is something that is becoming so fundamental, even though Hippocrates talked about this all the way from the beginning, all food or all disease begins within the gut. We're really starting to dive into that so heavily now, understanding how this whole world of our microbiome is so important to our overall health, not just cancer, but many other factors as well, such as mental health, such as inflammation, the way we're digesting, the different nutrients we're actually absorbing into our body are all coming from this. So these are just a few of the elements that are within this product that we know, I mean, has tons of research behind, but the biggest piece is just really understanding where soy is and what soy should be doing. The other last aspect I just want to definitely talk about is being a truly organic source of soy versus really what, I mean, it's probably 95, 99% of the soy products out there are GMO based. So what this means is, I mean, when the genetically modification process started in the beginning, really is designed to be able to add different pesticides, herbicides, all of this to the crops to be able to grow them in larger numbers and not have these different pests and herbs disrupt them. So they created these organisms that could be actually grown this way with using these different pesticides and herbicides, as well as just the overall genetic component of a GMO product is just not the same as an organic product. So with that said, it is, I mean, significantly higher of a product in terms of quality, but you're also not getting something less than nutrients. You're also not getting these extra pesticides and herbicides. Not to mention, I mean, we know now genetically modified soil is depleted of almost all nutrients at this point, where you're getting really not much in the plant ultimately, which that's just a whole nother factor if you're even getting what you're looking for from soy to begin with. So I hope that hopefully debunks a little bit and talks a little bit more about soy and just the differences, and really knowing a good product is, I mean, one of the biggest aspects.
Hey, Dr. Stone, we could get to this in the Q&A, but might as well clear it up now. There's a couple folks asking about, I mean, there was a lot of questions about, you know, organic versus inorganic and all that sort of thing. And yeah, it's like, you know, there are so many, you know, the phytoestrogens. There are studies on women who just ate, you know, flaxseed muffins after breast cancer. and and flaxseed's another thing with a lot of phytoestrogens in it. And just eating that flaxseed muffin every day had, like, the women that were eating the flaxseed muffin had, I forget the exact percentage, but it was a amazingly lower risk of recurrence than women who weren't eating a flaxseed muffin every day. If all phytoestrogens are bad, then that would be the exact opposite. However, that's that's one example, but there are some people asking about thyroid conditions as well, and concerned about phytoestrogens for thyroid conditions. Can you, as long as you're talking about it right now, can you dive into that a little bit?
For sure. Yeah. So for myself, some people, we do look into soy as being what's called a goitrogen. So actually potentially having the effect to decrease thyroid production overall by actually affecting it. For myself, I know with patients, I typically do a thorough thyroid history with someone, lab work that's always included to make sure this is the most appropriate setting for them. In clinical practice, having a small amount of these goitrogen foods within your diet, we often don't really see being as harmful to the body, especially the thyroid gland, as we typically think, especially someone that might be out there with cancer, having some of these sulfur-rich foods that actually help with detoxification, especially with the liver in stage 2 detoxification, can be hugely beneficial as well. So I think that's why anything any single person takes out there, it is so important to get medical advice, because every single person is so different, and really understanding their whole body, everything that's happened up until this point, and making sure the best therapeutic is added into their regimen is key. And that's why always going through something, especially for something that's like cancer, we want to make sure that this is the most safe and effective for every single person out there. And that's why working with a good doctor that definitely understands both conventional and these different alternative methods to healing as well, and could understand that in a holistic aspect, I think that's where you'll make sure you're safe. And if this is something that could be working, especially with something like thyroid, but there's many other factors we definitely look into too with every patient. So.
Yeah, and that's, again, I mean, one, work with your doctor, and not just your conventional doctor, but get a diverse array of trainings under you.
Real quick on the thyroid issue, Dr. Stone makes some good points. I mean, from a standpoint, as a representative of Haelan, we wouldn't want somebody to take Haelan if they're concerned about the thyroid. So we definitely want you to talk to your healthcare provider. We've not seen any issues because of our fermentation process and what we do. That does not speak to, what Devin's talking about too. It doesn't speak to conventional soy, trying to differentiate, because of what we're doing is so different. I see these questions about like, oh, how do you ensure your soy is organic and things like that? It's such a different process. It almost has to be a whole different category. So, and Ryan's right. I mean, if somebody calls in and their doctor says, hey, this is something, my thyroid's in bad shape, I shouldn't be doing it. Yeah, great. Not the product for you. Come back when your thyroid's in better shape. But for the most part, I mean, we've had a number of different people with thyroid cancers that have done really well. So it's not something that you can just blanket. And that's really like any situation. You can't just say, take this and you'll be great. You've really got to look at the individual. So to make blanket statements, I see this a lot surrounding soy is so terrible for your thyroid, avoid it like the plague. Well, not necessarily. I mean, the benefits could far outweigh anything that your body could very much, compensate for, that your body could very easily compensate for with just a little more iodine or something in your diet. So it's very easy to make like kind of a fearful or fear-mongering statement, a headline, a clip, a little headline clip, soy, blah, blah, blah is bad. You can't necessarily put what we're doing in that category. And then even beyond that, that may not apply to your health as well. So that's really good advice from Dr. Stone. We try to, like Ryan says, we answer the phone. You call us, we answer the phone, and we're going to talk to you about these kind of situations. Thyroid is one that comes up quite often.
I love it. Well, yeah, let's. We might be getting ahead of ourselves with the thyroid rabbit hole, but you guys want to.
Well, it's a good one. I mean, it's a common question. Yeah, it's a great one.
Yeah, but now, yeah, go into the I forget what you want to do the first, the history of the product or the the studies
Yeah.
behind it. But yeah, just keep us
Yeah. Well,
going.
let me talk a little bit about kind of the history of Healing 951. So, um, the original onset of the product was, or the formulation for the product was for late stage cancer cachexia. And cachexia, this I'm speaking to a crowd that might actually know what that word is. It's the wasting away. In late stage cancer, people lose a lot of weight. And so this lady was trying to basically come up with a natural way to combat that. And a number of different, fermentation techniques and foods and things like that. They came across this very specific species of soy. There's over 2,000 species of soy, so they're not all the same. So it's a very specific species of soy, and then developed a fermentation process to really break down the best constituents within that soy to help address this wasting away, this wasting syndrome. And this really started kind of the mid to late 80s. Then that as that kind of started taking off, there was a lot of studies, hospital studies around the cachexia. But then what they were also seeing was, okay, well, this is actually addressing a lot of other things. And so that kind of launched into a number of other studies. And then in the early, kind of late 80s and early 90s, that's when Joe Tedesco got involved and basically, realized the great potential of this product and assembled a team and took it into a further development. And so it started, as the fermented soy. Then we kind of landed on this Healing 951 formula that since 91 has been the same formula, our same patented fermentation technology. And we go to great lengths to ensure our crop, our soil. So we grow at elevation in Mongolia. And the reasons being is we can control a very, very nutrient rich soil. We fertilize with a volcanic ash. You're getting these great bacteria that are in the soil, and it helps to build a much more robust and strong crop. Just thinking about the soy here in the United States, the reason we couldn't grow here, the soil just isn't as nutrient rich. And to get something with the density and the specific phytonutrients that we're looking for, Mongolia was a great place. That elevation helps to eliminate the cross pollination. So when you grow crops over here, and if it's a lesser species of soy and it pollinates with our crops, that's a problem, because over time we end up with something different. So these steps that we take to ensure that, I don't know, it was probably 10 years ago, Ryan, that product was the same product when you started that it is now. Have helped us to maintain we've been around 30 years now, a reputation of consistency and to those studies being duplicatable in real life situations. So as the Tedesco family, kind of took over, they had this new formula based on that other fermentation process. The implications started being realized not just in cancer, which there was a number of different studies in cancer, and you can go to healing951.com. There's a studies tab, and check out some of the studies that are published online, and we have a bunch more that aren't even that are in other places. Those are just some of the linked ones, but different studies that like our PTSD study we did in 2011. It was a study with treatment-resistant combat veterans. So the mental health aspect of the inflammation in the brain, the hormone balancing, and even with that, seeing less viral loads and bacterial loads on the body. It really just showed how diverse the product is. I saw a question earlier about prevention. I mean, I still am taking an ounce a day most days. I just have continued to do that. We have a lot of athletes that train on it. So there's a lot of general health, muscle recovery, energy, lung function. There's just a lot of things that are inherent in a soybean when it's a true soybean, that organic fermented, that the body can utilize to repair, to modulate the hormones, to essentially be those building blocks with amino acids. That's another advantage of being a complete protein. So there's a lot of things going on in there that are great for addressing in those early studies, as we saw the late stage cancer cachexia, that are also great for the inflammation, oxidation in your body. And so that it's kind of launched us in this crazy journey with this product where it's like we have this following of people who've really known us in the cancer world, but then also, we'll get pro baseball players and CrossFit athletes and MMA fighters. So it's really strange. It's just kind of got a diverse setting.
Do you, yeah, I was curious. I remember Jared telling me about the PTSD studies that, he was saying that it's like as good as the cancer studies as far as the results they're seeing.
Yeah.
But I never heard like, what is the mechanism of action there? Like, why is it helping? Do you know?
Yeah, so there's a number of different things that were kind of brought to light in that study. One is, obviously like inflammation. There's and that hormonal element. PTSD is an interesting one because it's, and we tell people this all the time. You're not taking, so with cancer in a situation like that, you're taking like a bottle a day. And no average size person is probably taking about a bottle a day. It gets pretty expensive for that first, 90 days. Then after that, you kind of taper down. PTSD, I mean, we're seeing people get great benefit just 2 ounces a day. So much, much smaller amounts. And they're seeing that kind of hormone regulation, the inflammation in the brain. But there's also the element you still got to do the mental work. You still got to kind of work through the process. And these in the study, those folks, it was men, it was treatment resistant combat veterans. So they had already gone through a lot of the conventional treatments and now, had taken on Haelan. So if you kind of read through that, there's a lot of things going on, that the stress of bacterial loads, the stress of viral loads, and things that, they had picked up over the years, that alleviating that helped them to, sleep better and get better recovery. So it's not just one thing, it's a, this synergistic effect of a lot of things.
And I think it just goes back to what Jim was already saying. Just inflammation control is, such a huge aspect that we see with, most mental illnesses, anxiety, depression, that there is a lot of inflammation going on within the brain itself. So that's one of the huge aspects having a very highly anti-inflammatory food could help with, as well as like he was saying, the hormonal regulation. There's many different factors that can help with that, but he already stressed on that more than I was going to. So that worked.
Yeah, it's a pretty cool product, and I know I touched on a little bit before. I know one of the things that, for me, when I was, first kind of getting into it, I was pretty anti-soy. I was about as anti-soy as you could get, and
that's what you always hear, like when you first start digging into cancer, stay away from soy. But I'm pretty sure I know why that is. We won't get all conspiracy theory on everyone, but
maybe a little, yeah. Well, and I also show as having a soy allergy. So for me, I still, the soybean oils, obviously I don't want any of that. I don't want the seed oils and all that stuff. That's a whole nother conversation. But having dietary soy always made me, kind of feel off. It gave me a lot of gut issues, things like that. So I did some blood tests and showed like, oh wow, you're pretty, have a pretty strong reaction to soy. So that always kind of, irked me, where it was like, oh gosh, now I'm, looking at this product that Jordan sent me that's all soy. And to this day, we've not had a true allergic reaction. Now, that being said, if you have an anaphylactic reaction to soy, you need to talk to your doctor, and you need to, if it is something that you're passionate about bringing into your life, bringing Haelan in, try a very small amount. Just because it hasn't happened doesn't mean it won't happen, but it's one of those things where the fermentation process is really key. It's a multi-stage nitrogen fermentation process, and it's a pretty unique fermentation that we do. We actually have the patent on this fermentation, and the stages that it goes through actually breaks down that antigen. So the thing that people are allergic to is no longer even active in the fermented soy that we, in the end product. So for me, I've never, you know, I get on it and I feel great. I mean, it just gives me that kind of energy. And so when I first started, it was really wrapping my mind around it was kind of challenging because I was like, this thing that I had demonized for so long is now, you know, sitting in front of me, and I'm actually seeing some pretty dang good benefits from it. So it was an interesting thing. So I know a lot of people, you know, do, especially like you said, you come into this cancer, you do come from an aspect of soy being problematic. And don't get me wrong, there still is in conventional soy, there's still problems, as Devin mentioned earlier, with the xenoestrogens from these pesticides that do get introduced. So don't take these as blanket soy comments.
Yeah, and Sherry's, you know, and I think this might have been before we launched into it, but she always heard that soy is bad for cancer, which, yeah, again, you hear. And then what about the estrogen aspect? Our bodies produce estrogen. Our cells have estrogen receptors. So, I mean, it isn't, you know, there are phytoestrogens. I mean, if you're kind of under the mindset that plants are here for eating and they're good for you, there are estrogens in a lot of different foods. So why would there be, you know, phytoestrogen means it comes from a plant. Why would there be phytoestrogens in all these different foods if it's really bad for you, or if it, you know, causes cancer, or if it drives cancer, or whatever? You know, I interview Dr. Veronique Desagnier a lot, and she always makes the analogy that I know she's a big fan of Haelan as well, actually. But you know, if estrogen really caused cancer or really drove, and I'm not, you know, again, work with your naturopathic oncologist, your integrative MD that specializes in cancer, that sort of thing, because there are corner cases here and there. But I mean, for the most part, you know, she always makes the analogy that if you know, if estrogen really caused cancer, then every teenage girl you know, going through puberty, they'd all get cancer right away because they got that estrogen surge. So it's not the case. And then, you know, talking about phytoestrogens coming from plant versus xenoestrogens coming from the plastics. I mean, that's the real concern. And again, going back to your cells have estrogen receptors. If you're giving them the phytoestrogen, it's the estrogen that it's actually supposed to be taking in versus the, you know, really crazy, insane, out of control xenoestrogens that are coming from the plastics, then, you know, then those receptors are getting filled with the good stuff, and they're not taking in the bad stuff because they've already got their fill of the good stuff. So that's my understanding anyway.
Yeah, and soy, you know, phytoestrogen, particularly genistein, which you could go down a genistein rabbit hole on PubMed for days if you wanted to. But it's classified as SERM. It's a selective estrogen receptor modulator. So it's a modulation. And what we see is, you know, we get a lot of ladies that come to us with breast cancer, a lot, especially from Dr. V, because she sends us a lot of people. She had such great success for herself, and, you know, her you know, coaches, they all talk about it. So we get a lot of breast cancer that give us a call. And one of the things we see very, very consistently is these crazy high estrogens. As you get on the phytoestrogens, you get on something like a genistein, that it actually modulates it down. It actually causes an overall lowering. So it's kind of to something Dr. Stone said earlier. It's not what we expected, you know, from what scientists expected when they first looked at it. They're like, wow, this looks so close to estrogen. It should be problematic. But when it actually played out in real world and in studies, it just didn't react that way, and the body didn't utilize it in that fashion. So you know, we get the prostate cancers, we had a ton of prostate cancer and breast cancers because of that estrogen factor. Haelan is, you know, usually something that people bring on and see really, really good success.
And Jim, you mentioned genistein. I always call it genistein, but maybe it's genistein. I don't know.
It's like a precursor, genistein and genistein.
Oh,
genistein. Yeah, don't mind. It depends on, you know, when it's digested. It turns into the other. Yeah.
But yeah, I mean, you know, again, you could go on a rabbit hole and all day on all the studies. But you know, talk about some of the key flavonoids in it. Genistein,
Yeah,
what was it?
genistein, diadzin, and
Diadzin, that's the other one I always forget how to say.
and glycitin. And some people actually in their gut will produce equal. Not everybody does, but that's also a digestive byproduct of genistein that's also has some great anti-cancer benefits that come from those isoflavones. But not only do you have the isoflavones, you have things like the Bowman-Burke inhibitors, a protease inhibitor. You have saponins. You have phytosterols. Phytosterols. That's where you know how there's always been this like soy and cholesterol connection. Well, that comes from the phytosterols. They're a plant, just like the phytoestrogen looks like the human-based estrogen. Well, the phytosterols are like a cholesterol and actually can help to cause a lowering in cholesterol. So people have looked to soy for things like that as well. Devin and I were just kind of talking about something along that vein yesterday. But yeah, it's you get all those amino acids, you get enzymes that are created during fermentation. I mean, it's the synergy of all of that working together. You're not just getting this high dose of one thing that you're expecting, to be your, one lane of attack, if you will. It's really synergistic in the whole thing.
Yeah, and that's, I mean, you can dive into, again, going just going down the genistein rabbit hole and seeing all the research there. But that's one of the things I mentioned in my email talking about this, is it just, you mentioned all the different amino acids and enzymes and on and on and on. It's an overall nutritional synergistic boost, as well as that you're not going to get even from your carrot juice or whatever. It's just, there's a lot that goes into it, and there's a lot that is in it. Yeah.
What's interesting about the genistein too is one of the things that, you read some of these studies and you find is bioavailability. And that can be problematic if you don't have, it's like you're taking this horse pill of genistein. Well, in a fermented format, it really helps the body to just start assimilating it right away. And so that's another reason fermentation is awesome. When you start, there's things I do just at home with fermentation and sauerkraut and kimchi and things like that, because of the probiotic benefits, the gut benefits, the way that it helps your microbiome. So, and it helps your body to start digesting as soon as it hits your lips. You're not waiting for the gut to do it too. So fermentation is really a big part of what makes, what really takes the soy from good to, great to very, very beneficial.
Valerie asked a pertinent question. She said, synergistic secondary nutritional factor. Okay, heard about that. How about direct apoptosis effects when it comes to cancer cells? I mean, and that's again one of the things. One, you can dive into just genistein and cancer and read about the apoptosis. But I mean, one of the things I love about Haelan is like, it's not just, you're not just saying if you were a curcumin company or something, saying go and look at the studies on curcumin. There are a whole ton of studies on Haelan 951, and that's, I guess, more from a clinical how people did perspective. But yeah, I mean, any more specifics on like direct anti-cancer effects is kind of always front and center of people's minds going through cancer.
Yeah. Absolutely. So from an apoptosis effect, there was if you're on the website, you can check out, there was a 2015 somewhere in there on pancreatic carcinoma. So that's a documented induction of, it says Haelan 951 induces apoptosis into pancreatic carcinoma. That's the title of the paper. So there's definitely implications for lots of other cancers kind of scattered throughout some of the other studies, but that's a pretty direct showing. And we're also kind of in the middle of something. We had a preliminary thing where they saw that with the RGCC testing, and that's another thing that they noted was induction of apoptosis. And genistein, you see that as well with genistein, and the protease inhibitors, Bowman-Burke inhibitor, both all exhibit that.
Definitely. Yeah, that's something I was just going to add on, are the protease inhibitors as well, which not always are just direct apoptosis, actually like blowing up the cell as we see it. But we see that actually in studies, what protease inhibitors are, they actually stop the protein production within cells. So the cancer is regenerating, recreating new versions of themselves, which we know happens at an accelerated rate compared to most cells. It actually could stop those mechanisms through protease inhibition. That's what this is. And the awesome part about this with studies with these soy fermented products is they actually target the cancer or mutated cells directly and not affecting our own cells. This is how, I mean, just brilliant the plant world is working alongside of our bodies. I mean, we know how to work together one-on-one, and this is just one of the many mechanisms we see helping, especially with something like cancer.
Yeah. Any other main highlights on the studies and the research on it you guys want to point out?
I would like just to touch base too, just because, I mean, this is the #1 killer in the whole United States is heart disease, especially stemming from just our different lipid dysregulation. And I know Jim briefly mentioned, yes, it does have cholesterol in it. However, this is a good form of cholesterol, and something so fundamental with the fat that's actually within soy called phosphatidylcholine. We see that this actually could regulate all of our lipids within our body. It helps increase HDL, helps decrease LDL, it helps decrease triglycerides. There's not a single drug on the market that could actually handle all of these by regulating our lipids in the right level. And not to mention, you don't have the side effect profile that many of these have by, especially like our lipotors that shut off our HMG-CoA reductase enzyme, which depletes CoQ10, which is vital for heart health. So we're getting any negative side effects, vital for cancer, vital for, I mean, muscles, so just so important for so many aspects of our health. And we're getting that from this type of product without the effects that we could see conventionally and getting just so much more out of it. When I was speaking to him yesterday about, me and one of my colleagues were actually looking into setting up a study just on this agent alone, the phosphatidylcholine, for regulating lipids for patients. And he actually brought it up to me, and I mentioned, well, hey, I'm actually the product that I'm working with. This is one of their fundamental aspects within their ingredient. So we're looking at maybe collaborating together here in the near future for these larger studies as well.
I've saw a few kind of things, and I think it'd be good just to touch on potential applications. So some of the things I know I mentioned, sports recovery and things in a general health type of thing, you know, viral loads, bacterial loads. We've done studies with malaria and things, seeing that activation of macrophage and non-specific just immune function, because I got a lot of people who, you know, will take just an ounce a day, you know, kind of a small amount, half an ounce to an ounce a day as a general health thing, you know, do that for a month on, kind of like you do with the other stuff, is do it for a couple months, and then, you know, maybe bring that in next fall or whatever you do. So there's definitely applications in that, but some of the other things that we've seen, other than the PTSD and the cancer, is rheumatoid arthritis. That's another one that people report back. You know, for those who are going through traditional treatments, the side effects are severely mitigated traditionally, is what we've seen. So if you are doing some type of chemotherapy or radiation, what's really cool about these plant-based antioxidants is they actually help to protect healthy cells. And it's kind of this funny thing that, like you said, the plants just, there's the intelligence, if you will. You would think when you're going in with an agent like chemotherapy to rapidly oxidize something, that it would just, you know, get everything. But it's really cool how, you know, the constituents in soy can actually help to protect. Well, that's the Bromin Burke inhibitor too, is noted for that, to help protect healthy cells that have not mutated in that way. It's really cool. So we do see a lot of people with reporting less hair loss, more energy, things like that. So as an adjunct to those traditional treatments has been great as well, because you know, it's you know, some people do go that route, and you know, like it's you know, I'm not like pro or anti. You got to make your own choice for yourself. And if you go that route, it's always nice to have things that protect the body, that keep you strong and get you through it and feeling good and able to function well. So so yeah, rheumatoid gut issues, a lot of people with gut issues and you know, disbalances, things just like an ounce a day can be a lot of aid in those situations as well. And then, like I'd mentioned before, PTSD is usually like 2 ounces, sometimes up to 4 ounces a day for a bigger guy. And then in a cancer situation, very, very generally, this is why Ryan said, call us. We are happy to jump on a phone call. We're going to just give you some suggestions based on, this 30 years that we have doing this. But in a cancer situation, usually it's that bottle a day. You split it up throughout the day, 4 ounces in the morning, 4 ounces at night, and do that for around 90 days, 100 days, and then kind of taper down, look at your blood work, that kind of a thing. And we do make a powder, which we didn't make this when Ryder started, but we do make it's a lucuma, monk fruit, peppermint, very, very clean, organic ingredients that it's just a powder you can mix right in with it that helps to get over the taste a little bit. So if the taste really bothers you, definitely pick up some of that powder, and it helps. It'll help you get it down until, you could start drinking it straight, or you can continue using that. Either way, it's great.
No, yeah, and it's like you said, the more you take it, the more it's just your body kind of craves it. Like you said, it's just knows what's good for it. And speaking of other potential applications, I mentioned that one, if you're going through cancer, your immune system's a really big deal, and then two, I don't think the immune system has ever been under the spotlight. Yeah, I don't know if we talked about immune modulation a whole lot specifically or not, but I mean that's one of the big wins for Haelan as well is just overall immune support, right?
Yeah, absolutely. I just looked at my notes too. There's two I forgot. ALS stabilization. We had a pilot study. You'll see that on the website for stabilizing ALS. That was fantastic. Dr. Kerry Goda did that pilot study, and he noticed just very significantly less infections, things like that. So her immune system was functioning much more optimally given her situation. And then we've also seen, we have a couple places that have used Haelan over the years with Lyme and seen some good results. But I will caution, if you do know you have Lyme and that is something on the table for you, start really slow and stay at a lower amount. So, but yeah, those were two that I forgot to mention.
Yeah, let's get into some Q&A. Anne's asking about the various cancer types. Is it good for any cancer? She's going through malignant melanoma, metastasized to the spine. Any experience with this type of cancer? Yeah. So anything to say on melanoma specifically?
Yeah. So in a broad sense, there's really not there's not been a situation where we've not seen any benefit. Now, some like we mentioned before, the estrogen driven, that pathway, if we can go after that, if it's a prostate or breast cancer, that's great. Ovarian. With the melanomas, yeah, we've seen a lot of melanomas. We've seen a lot of, I saw blood cancers in there as well. We've seen a lot of that, seen some great things, and the blood work come back. Just in that first 90 days, we've seen some great stuff. Things like the more dense tissue, bone cancers, it's going to take longer. Pancreatic carcinoma, usually that's another more challenging one. And again, it's you're doing a lot of things. I don't think that Haelan is the thing that is going to be your silver bullet or whatever. So as an adjunct, I think there's a very broad benefit to adding it to your or at least talking to your provider about adding it to your protocol or whatever you are doing. So we've seen a lot of melanomas, seen some great success with melanomas, all the way from skin cancers, like I said, thyroid, brain, glioblastoma, neuroblastoma. I mean, mine was colon cancer. So it's just a very broad range of benefit.
All right, and we did address the thyroid issue pretty extensively, but Aviva's asking, if soy drives down the thyroid hormone, which again, that's it's a little more of a nuanced issue there, but can it also increase bone loss and osteoporosis?
Definitely. That's
a doctor question.
Yeah, no worries. Not something, especially if we are targeting certain diseases. I think we always outweigh pros and cons with everything. I mean, same thing with conventional treatment. We know chemotherapy, radiation, all these are not just something that is completely benign, but every single patient, that's why we need to understand their whole history and what is the best therapeutic to get them healing ultimately. So that's something I look into with all my patients. With that also said, using soy-based products, I have not seen bone loss or bone density loss with any patients that I've worked with over the years, as well as, like I said, my head oncologist, who is also a FABNO fellow in oncology. Her biggest recommendation to me was her patients, she always puts on these type of products, soy products, any of the brassicas, because at that time, it really is important to make sure we're targeting what is the highest force of intervention that we need to go after for each patient to make sure they get into a healing state. I mean, ideally, anything, this is not going to be always a long-term protocol for life. We want to get you to a phase where you're healthy, and then we'll start reevaluating what's the next best plan for yourself. So.
That's a good answer. Marta's asking, she had breast cancer, had a mastectomy, chemo and radiation, plus integrative therapies, all in 2019. It's gone, but she's still on an aromatase inhibitor. Same time they discovered, she also has primary hyperparathyroidism caused by 3 adenomas on my glands. Breast cancer recurrence prevention / hyperparathyroidism. That's a whole ball of wax there, but any thoughts between the two of you?
I know, just to start, that's something Dr. V talks a lot about when it comes to breast cancer prevention. I mean, you watch her videos, she opens up her fridge, it's in there. It's one of those things that having that continuous at lower amounts, you're not doing that bottle a day, but just an ounce a day, even if you're doing 4 or 5 days a week, an ounce a day is great. And kind of cycling that into your thing. As far as the rest of that might be something, do you have any thoughts on that?
Yeah, so I mean, this is just thinking in theory. Like I said, really, if this is the most effective for you, I would need to know your whole history. So this is just, yes, it may be beneficial for yourself. Definitely need, to fully understand your case to make sure this is the best therapeutic for yourself. But especially with high calcium levels, there is an agent within soy that's called phytic acid that actually will help lock onto some of the minerals in the body and actually could help deplete some of those levels. So there could be some benefit just from that own agent alone. But like I said, really understanding your full case, and it's something I would highly look into, because this definitely could be a great therapeutic to add in your overall program, and something that, I've seen just so many benefits with, and will keep helping others.
And then, on the just, is soy good or bad front, I think we covered that pretty extensively, but DA is asking, are fermented soy products the best way to consume soy compared to edamame or tofu? And, I know there are studies on, same sort of thing, like I mentioned with like flax seeds and stuff like that. There's certainly still a lot of good studies on straight edamame. Non-fermented soy needs to be organic and come from a good source and all that stuff. But where do you guys land on the fermented versus non-fermented? I know with fermented you're just getting a whole ton of extra stuff, like you just mentioned. But is all non-fermented soy bad, or where do you guys stand on that?
Yeah, for myself, if it is good quality soy, like we said, that's the biggest distinction to begin with. But soy itself, I do believe there are some good benefits in adding that in. However, just like you're saying, it's taking those benefits and just stepping it up a whole nother level. With the fermentation process, obviously you're getting all the probiotics now within it, which we have, just so many benefits that are coming from that. Like we spoke about, inflammation control, helping with vitamin production, helping with hormone production, neurotransmitter production, which helps with, just overall well-being. There's so many aspects there with fermentation. The other piece with fermenting a food as well, it actually is going to activate certain enzymes within the food product itself that actually makes a lot more of the agents within it what we call bioavailable. So now they actually have the enzymes to work and do the job in their body on a higher level.
Here's a good one. Mary Frances is asking about people with histamine problems that aren't supposed to eat fermented foods. What's the consideration there?
Yeah, I've had a number of people who have histamine issues. Doesn't take long for them to get used to healing at all. Typically, it's more of that, initial reaction, but it is not been an issue for people who are really, histamine, have a, intolerance.
And yeah, Becca's asking more about the protective aspect for a woman going through radiation for breast cancer. And I mean, I know, yeah, I know you've got literal, actual smaller clinical trials of, side effects were reduced and that sort of thing. But anything more to say about radiation in particular?
There was some smaller ones, and then there was also a really early on initial one was like 300 hospital patients, and they covered radiation and chemotherapy. Saw actually a higher cancer cell death rate, which is great, and then less side effects. So definitely something to look into. In that situation, if you can have it on board, a week before or 2 weeks before that treatment, that seems to be a better situation. Kind of get it in the body and in the system for a little bit first.
Sherry was just on our Going Integrative Plus member call. Have you had enough of me yet, Sherry? She's asking about, this is like an all day Ryan marathon for you, Sherry. Good. I'm not even going to say good for you. You've had enough of my rambling by now. But does Haelan affect cancer stem cells as well as the daughter cells?
Yeah, that is one of the things that a lot, it goes back to these plant based compounds. That's something chemotherapy just can't do, is the cancer stem cells, and soy is, genistein in particular too has shown that.
Yep. Yeah. Look up genistein and cancer stem cells in particular, not just cancer. You'll find a lot of good stuff. And we kind of went into this, but it probably bears repeating from a maintenance perspective. How much did you take a day? And that's the 1 or 2 ounces, Jim?
Yeah, typically. So I mean, half ounce to an ounce is kind of a good place to start. See how you do. And a bottle is 8 ounces. So if you're doing, let's just say you're doing a half ounce, 16 days that you're going to have the product. But an ounce is a good kind of like for my size, what I do. I do like an ounce a day pretty consistently, and then I'll take a little break and then I'll bring it back on. A lot of people do that.
Yeah, you don't, it's what I preach is rotation. You don't want to take the same thing all the time for years. You got to keep your body on its toes. You got to keep cancer cells on their toes, mix it up, that sort of thing. But yeah, circling back to an ounce a day for a month, for a couple months, for a few months, never a bad idea. Sherry's asking about contraindications. Any drug interactions, any known conditions that it wouldn't be a good idea to take alongside Haelan?
Anything where you're trying to suppress the immune system, you wouldn't want to do, you wouldn't want to take, an immune suppressant for like a bone marrow transplant or something like that. Anytime you're trying to suppress the immune system, it's not a great idea. But other than that, we don't have any official contraindications. I mean, obviously, there's new stuff coming out every day. So, chat with your provider about that. And, the constituents of soy are pretty well studied, especially in more recent years. And there's a lot of good data kind of starting after 2012 that there's some good studies out there on the benefits and the constituents within soy and what might or might not interact.
And Diane's asking more about your personal journey, Jim. On she asked how long were you on 951 to cure your cancer. I'm sure you wouldn't put it like that. And by the way, I should have thrown out the good old disclaimer at the beginning, but we'll do it at the end. Don't take anything you just heard or or here in the last little bit of the Q&A to be medical advice, diagnosis, or treatment. We're just talking about things we know. But yeah, did you do that basic 90 days hard on a bottle a day and taper off from there kind of approach?
Yep, 4 ounces in the morning, 4 ounces at night. That's half the bottle in the morning, half the bottle at night. And I didn't have that fancy powder to make it taste better. And so you just shoot it back. Did that for 90. I probably did maybe a little more than 90. Then I tapered down to I think I tapered down to 2 ounces and then one for a month and then 1 ounce after that. And that's pretty typical, is to kind of taper off. And then I did 1 ounce a day for quite a while. And then, after it's been, a few years now. So, now it's just kind of cycling it in as I feel it's needed, type of thing.
Valerie's asking who is Dr. V. Yeah, Dr. V is Dr. Veronique Desaulniers, Desaulnirs, IERS.
That's why we call her Dr. V.
That's why we call her Dr. V. But yeah, no, she's been like one of the, she's been out there for decades talking about, she went through her own, she was a practitioner before she got breast cancer, and then she went through a breast cancer journey, and she went through 2 breast cancer journeys actually, and beat them both. And she's just an all-around good soul, wealth of information, especially she kind of specializes, if you want to call it that, in women and breast cancer. Here's an interesting one. Have you had veterinarians use your product for their patients?
Have you ever seen the movie The Edge with Anthony Hopkins? He was like, there was a big bear.
Oh yeah, I remember the bear. Yeah.
That was Bert the bear. So we've had a lot of animals on the product, and Bert the bear had like 12 tumors. We kept that bear alive a long time, and he was drinking like 10 bottles a day. I mean, it was a very expensive bill for that bear. But yeah, pretty incredible story with Bert the bear. But we've had a lot of dogs, cats, with various, cancer issues that have responded really well. And obviously, it doesn't take nearly as much, and the dogs, they seem to like it. Doesn't really bother them much as far as taste. But yeah, a lot of vets over the years. We've actually even had one veterinary insurance company reimburse for it, which was kind of cool.
Really?
And that's another thing we never really talked about is Haelan is listed as an insurance reimbursable product. So if you were on private insurance, so non-Medicare, Medicaid, there's a good chance you might get a reimbursement with that cachexia, pre-cachexia, or cancer diagnosis. Blue Cross, Humana, Aetna, that we've seen some pretty decent reimbursements. And we have a whole packet on how to do that. It's a little bit complicated process, not on our end, but on the insurance company's end, to get it done. But, well worth it if you can get the reimbursements.
Yeah, no, I mean, especially for, kind of a big needle mover like this that isn't necessarily cheap. People going through cancer, you're trying to pack as many of those things in. So if you can get, especially if it's something you're going to be, going hard at, taking for a while. I completely forgot about that. That's like one of the biggest things is something you can actually get your insurance company to pay for, which, to my knowledge, I haven't really come across anything else in the holistic, alternative, integrative, whatever you want to call it, world, that's not like a drug that you can actually get your insurance company to pay for. That's huge, or reimburse anyway. Yeah.
Mm-hmm.
Ann's asking about your journey with colon cancer, Jim. Any other like things you were doing besides the general, all the lifestyle good stuff, any other therapies in particular that stood out to you that helped move the needle?
Yeah, I think, obviously we talked a little bit before, lifestyle stressors, food was a really big one for me. Haelan, curcumin, I'm a big fan of curcumin and some various, mushroom things. And I cycle in, I couldn't tell you one. I mean, I could, but I don't have one particular, supplement, branded supplement or whatever, but bringing in various different mushrooms and things like that, I think had really helped. And then the probiotic benefits of kind of rebuilding my gut back up. I had also had H. pylori, so the mass had kind of caused that H. pylori up line in the stomach. So there's a lot of things I was getting over at the time. And so I think that from a product standpoint, definitely curcumin was a big one. Different mushroom. I was actually making my own mushroom teas during that time. And but lifestyle, stress was probably, I'd say Haelan and stress were my probably biggest things, is getting rid of my very stressful situation and bringing on Haelan to calm myself down.
Yeah, you get the PTSD effect all in one. Yeah.
Yeah, but I mean, also, I mean, I think heat, so sauna is a great thing that I, still do. It's just a lot of things that I think are very beneficial.
Oh yeah. No, I'm a big sauna preacher, as I'm sure most folks on here know. Getting towards the end here, who is it? Troy is asking about he's taking genistein or genistein and already, and he's looking at the ingredients on Haelan and not seeing how much genistein per dose is in there or whatever. And again, you mentioned that at the beginning, if you're taking a big old horse pill, as you call it, of genistein, how bioavailable is it versus what you're getting in Haelan. But yeah, any specifics on the genistein content?
Yeah, I don't have that on offhand. It's not going to be, that's kind of to your point of what I said earlier, is it's not going to look the same because of that bioavailability factor. You may think like, I don't know how much genistein you're taking, but let's just say it's, XYZ milligrams of genistein per day. It's not gonna be near that because it doesn't need to be, in the synergy of working with all the other phytonutrients. So it definitely wouldn't hurt. I mean, it is a significant amount. It takes about 25 pounds of soy to make one 8-ounce bottle. So, I mean, it's fairly concentrated.
I would say that's extremely concentrated.
Yeah. But it may not be as concentrated as just a genistein supplement. So you could even add it together, with that genistein. I know some people do that, especially if you score really high on an RGCC test. Like if you come back and you ping really high for genistein, usually Haelan is a good thing to add in as well. So it's not going to tell you, it's not a supplement. That's one thing we didn't really cover, is it's not a supplement. It's a food. It's classified as a food. So we don't list out those, specific blends because it is a, whole food fermented product. We're not breaking it down and putting it back together, if that makes sense, we're not breaking it down and formulating it back together. It's that whole food being fermented all as one unit.
I think I think we covered the questions. Again, everybody, these guys are not your average company. They want to talk to you. So if you do have any more questions, just follow up with them directly. Any parting thoughts from Jim or Dr. Stone?
For me, I just want to say it's awesome to see how actively engaged so many people are on this platform, because for me, that's one of the most important aspects of health. You are your own best healer. Ask questions, ask information, and seeing everyone show up and do that, brings a lot of warmth to me just overall. So thank you all who did chime in, and thank you as well, Ryan.
And again, this was a recording from the weekly webinar series. We invite our entire Stern Method and Anti-Cancer Revolution email list to attend and ask questions live as they happen. Please know that any product or service featured on this series is something I personally feel very strongly is something that has helped my son and family in our own healing journeys. It's only the best of the best, in other words. We're very serious about that and refuse to talk about something we don't enthusiastically use for ourselves. As you can tell from what you heard on this episode, you can use code STERN, S-T-E-R-N, for a great discount at any time on this company's site, and you can find that link and any other information you need to get it in the show notes. And also know that for the week after we actually did this webinar live, the discount was way bigger. The agreement we make with all the companies we feature on our live webinars is that they're going to give our audience an unheard of deal, something way more exciting than they'd hear on a podcast or see in a social media ad, but only for a week. And then after that week-long period, it drops down to more of the standard podcast or social media discount. So if you're the type of person that's always on the lookout for the best possible deal on the best possible healing products, from supplements to gear and devices or healing services like testing or more energetic type stuff, and if you're listening to this podcast, I don't know why you wouldn't be, you need to be on one or both of our email lists. You can click the link in the notes to sign up for the Anti-Cancer Revolution, which is the official email list of this podcast, delivering the show notes for all types of episodes we do, along with other cancer-specific information right to your inbox. and the Stern Method, which is our family brand where we show all of our strategies and routines to incorporate all the healing stuff you hear on these podcasts into our lifestyle, along with other important things happening in the health world. And I should also mention here that for many of the products featured on these webinars, our Going Integrative Plus members actually have access to that crazy, unheard of deal anytime they want, instead of just for the week when the webinar actually happens. If you've listened to the other episodes of this show, you know that Going Integrative Plus is the resource my wife and I have created to make it possible for everyday people to ask their own questions to the top holistic cancer doctors in the world each and every week, which is the most valuable thing we could imagine for someone concerned with cancer. But in thinking about how to make it even more valuable, we've worked it out with a lot of the companies you hear on these webinar episodes to actually offer that crazy deal that's only supposed to last a week to our members year-round. So in all reality, you could be a member and never get on one of our live Q&A calls, which I don't know why you wouldn't, but even if that were the case, you'd still be coming out way ahead just utilizing the discounts. You can see all aspects of the community and become a part of it at goingintegrativeplus.com if you feel like this would be a helpful thing for you. And as always, remember, if you're going through cancer or anything else you'd rather not be, just keep going. God bless and Godspeed, and we'll see you on the next one.